How do you use the facts you've learned in your day-to-day life in your work field?
Well, it's the basic sciences of medicine that helps you prepare to be a physician, and there's so many things that we learn during medical school and internship and residency to apply them when we're taking care of patients.
Have you ever had to go off track and use your own thinking skills instead of not using the facts given? If so, how did you feel about that?
Well, you have to have an intuition of how a patient's going, and the basic medical sciences are an important foundation for what you do every day, but after a while, when you've had years of experience, you you try to put everything together as far as the sciences and the education you've learned, but also how the patient presents and what you think might be the right answer. And it doesn't mean that you're always right, but over a period of time, you find out that you have to combine both of them, your the education you've learned, but also the skills you learn from just taking care of patients on a daily basis.
And do you... You're good. Do you like being able to think on your feet about situations at hand, or do you like to stick to what you know and try anything different?
I think thinking on the feet is probably the things that I enjoy the most of going to see a patient and seeing what your instincts are of what they need and what's going on with them and what you need to do. But you got to understand that what I do as an anesthesiologist is sometimes very cut and dry as far as the medications we give, but a lot of times you have to decide what's going on before you put a patient to sleep or wake them up as far as their clinical condition and whether they're in a physical state that you should put them to sleep. So the answer to your question is I like thinking on my feet.
All right, cool.